So there are two basic ways to approach the spine surgically. There are the older techniques of open traditional surgery, which still sometimes have to be used for certain conditions. But then there's also minimally invasive techniques for many operations on the spine. There are some differences, of course. The open surgery involves, big incisions, sometimes like this, sometimes even bigger. Minimally invasive surgery, typically the incisions max out at about this big instead. And so when you make a large incision for open surgery, you're actually opening things up and exposing the bony parts of the spine, and you're stripping the muscles away from their attachments to the bones and pulling on them for an extended period of time while you do the work that needs to be done. With minimally invasive surgery, you're leaving those muscle attachments all in place, and instead you're dilating a pathway with tubes down between the muscle fibers, so the muscle fibers just spread apart like this. And then once you're finished with the work that's done at the bottom of the tube, which is incidentally done with an operating microscope, then once it's finished, you slide the tube out, the muscle fibers just fall right back together. It minimizes the formation of scar tissue, so not nearly as much scar tissue with the minimally invasive surgery. With the minimally invasive techniques, you're not creating near as much dead space. Dead space is space that, when you open up tissue, it falls back together, but it takes time to heal. And oftentimes in that dead space, fluid or blood will accumulate, and that's a huge attractant for bacteria. And so therefore, the risk of infection with minimally invasive surgery is way less. There's less surgical pain because you've got much less of an incision and less muscle trauma. So patients stay in the hospital for fewer days because their pain management is easier afterwards. And again, back to work happens much more quickly with minimally invasive surgery. Patients just do better overall and overall have fewer complications. So with the minimally invasive surgery, because the incisions are really small, maybe an inch or slightly larger at most, the scars are a lot less. So cosmetically, and it's an advantage. With these small incisions, we don't use stitches or staples externally. All the stitches are underneath the skin. Then we put a layer of surgical glue on top. And most of the time we just use a Band-Aid for the dressing afterwards. They heal up very nicely. Eventually, the scars just end up as little lines on the patient's skin. If you're considering spine surgery, please contact our practice to see if you're a candidate for one of these minimally invasive techniques.